11 common medications that can damage your kidneys. Did you know? Your kidneys, small yet mighty organs, filter an astounding 50 gallons of blood every single day. These bean-shaped powerhouses are critical for maintaining balance in your body by removing toxins, excess fluids, and waste products. However, as resilient as they are, your kidneys can be vulnerable, especially when exposed to certain medications that may harm their delicate tissues over time. While many of these medications serve important roles in treating pain, infections, and chronic conditions, they can sometimes have unintended side effects on kidney health. In this article, we'll take a deep dive into 11 common medications that can damage your kidneys, explain how these medications work, why they can be harmful, and share actionable tips for protecting your kidney health. Understanding how medications impact the kidneys. Your kidneys perform a multitude of vital functions, including filtering waste from your blood, balancing fluids and electrolytes, regulating blood pressure, and producing essential hormones. Because the kidneys process most medications, certain drugs can overwhelm their ability to function, especially if taken in excessive doses, for prolonged periods, or under specific conditions such as dehydration. Kidney damage caused by medications can manifest as acute kidney injury, AKI, a sudden decline in kidney function, or chronic kidney disease, CKD, which progresses over time. Individuals with underlying health conditions, such as diabetes, high blood pressure, or pre-existing kidney disease, are at an even higher risk of experiencing kidney-related complications from medications. Let's explore the medications you should be mindful of, including both over-the-counter, OTC, and prescription drugs. 1. Nonsteroidal anti-inflammatory drugs, NSAIDs. Examples: ibuprofen, Advil, Motrin, naproxen, Aleve, aspirin. NSAIDs are among the most widely used medications for relieving pain, inflammation, and fever. While effective, they can pose significant risks to kidney health when taken in high doses or over extended periods. NSAIDs work by blocking the production of prostaglandins, chemicals in the body that cause pain and inflammation. Unfortunately, prostaglandins also help maintain blood flow to the kidneys. When prostaglandin levels are suppressed, kidney blood flow decreases, potentially leading to acute kidney injury or, over time, chronic kidney damage. The risk is especially high for individuals who are dehydrated, have heart disease, or already have kidney problems. How to protect yourself. Use NSAIDs only when necessary and in the lowest effective dose. Avoid long-term use unless prescribed by a healthcare professional. Stay hydrated while taking these medications. 2. Antibiotics. Examples: vancomycin, gentamicin, amikacin, ciprofloxacin. Antibiotics are life-saving drugs that fight bacterial infections. However, certain classes of antibiotics, particularly aminoglycosides, can be toxic to the kidneys. These drugs can damage the nephrons, the microscopic filtering units in the kidneys, leading to nephrotoxicity. The risk increases with higher doses, prolonged use, or in individuals with pre-existing kidney issues. Additionally, some antibiotics, such as ciprofloxacin, can cause the formation of crystals in the kidneys, further impairing their function. How to protect yourself. Always take antibiotics as prescribed, and never exceed the recommended dosage. Inform your doctor of any kidney problems before starting antibiotics. Drink plenty of water to flush out the medication from your system. 3. Proton pump inhibitors, PPIs. Examples: omeprazole, Prilosec, esomeprazole, Nexium, pantoprazole, Protonix. Proton pump inhibitors, PPIs, are widely used to treat acid reflux, heartburn, and stomach ulcers. While generally considered safe for short-term use, long-term use has been linked to an increased risk of chronic kidney disease. PPIs can cause inflammation of the kidneys, known as acute interstitial nephritis, which may progress to more severe damage if left untreated. Studies suggest that kidney problems from PPIs can develop silently, without obvious symptoms, making routine monitoring essential. How to protect yourself. Limit PPI use to the shortest duration necessary to manage your symptoms. Discuss alternative treatments, such as H2 blockers, with your doctor if you require long-term acid reflux management. 4. Diuretics. Examples: furosemide, Lasix, hydrochlorothiazide, HCTZ. Diuretics, commonly referred to as water pills, are prescribed to treat conditions like high blood pressure, heart failure, and edema. These medications work by increasing urine production, which helps reduce fluid buildup in the body. However, excessive fluid loss can lead to dehydration and imbalances in essential electrolytes like potassium and sodium. Over time, this strain on the kidneys can impair their ability to function properly, especially in individuals with pre-existing kidney issues. How to protect yourself. Monitor your fluid and electrolyte levels regularly when taking diuretics. Follow your doctor's dosage instructions carefully and avoid self-adjusting your medication. 5. ACE inhibitors and ARBs. Examples: lisinopril, enalapril, losartan, valsartan. ACE inhibitors and ARBs are essential for managing high blood pressure and protecting the heart. However, these medications can reduce kidney function in some individuals, particularly those with low blood flow to the kidneys. This effect is usually mild and reversible, but in rare cases, it can lead to significant kidney injury. How to protect yourself. Regularly monitor your kidney function through blood tests. Notify your doctor if you experience symptoms like swelling, fatigue, or changes in urination. 6. Chemotherapy drugs. Examples: cisplatin, methotrexate. Chemotherapy drugs target rapidly dividing cancer cells but can also harm healthy cells, including those in the kidneys. These medications generate a large volume of waste products that the kidneys must filter, increasing the risk of kidney toxicity. How to protect yourself. Discuss protective strategies, such as hydration therapy, with your oncologist before starting chemotherapy. Monitor your kidney function throughout treatment. 7. Lithium. Lithium is a commonly prescribed medication for bipolar disorder and other mood disorders. While highly effective, long-term use of lithium can lead to chronic kidney disease due to its effects on kidney function, particularly in regulating water and salt balance. How to protect yourself. Ensure regular kidney function tests if you are on lithium therapy. Work closely with your healthcare provider to maintain safe lithium levels. 8. Antiviral drugs. Examples: acyclovir, tenofovir. Medications used to treat viral infections, such as herpes and HIV, can sometimes cause kidney complications. Drugs like acyclovir can form crystals in the kidneys, while tenofovir may cause tubular dysfunction, a condition where the kidneys struggle to reabsorb vital nutrients. How to protect yourself. Drink plenty of fluids to prevent crystal formation. Discuss regular monitoring with your doctor if you're on long-term antiviral therapy. 9. Contrast agents for imaging scans. Contrast dyes, often used in CT scans and MRIs, can cause a condition called contrast-induced nephropathy, (CIN), which impairs kidney function. Individuals with pre-existing kidney disease or diabetes are at higher risk of this complication. How to protect yourself. Notify your doctor of any kidney issues before undergoing imaging scans. Request alternatives if possible or ensure you're well hydrated before the procedure. 10. Over-the-counter laxative. Examples: sodium phosphate-based laxatives. While laxatives are commonly used to relieve constipation, excessive use, especially of phosphate-based laxatives, can lead to dehydration, electrolyte imbalances, and kidney injury. How to protect yourself. Use laxatives sparingly and only as directed on the packaging or by a healthcare provider. Opt for milder, non-phosphate-based options if you need frequent relief. 11. Herbal supplements. Examples: products containing aristolactic acid. Herbal supplements are often perceived as natural and safe, but many are not regulated and may contain harmful substances like aristolactic acid, which has been linked to kidney failure and even cancer. How to protect yourself. Always research supplements before use. Consult your healthcare provider, especially if you have underlying kidney concerns. Protecting your kidneys. Proactive measures. 1. Stay hydrated. Proper hydration helps the kidneys efficiently flush out toxins and medications. 2. Follow prescribed dosages. Overdosing or misuse can significantly increase the risk of kidney damage. 3. Monitor kidney function. Routine tests can detect early signs of kidney issues, especially if you're on long-term medications. 4. Avoid self-medication. Always consult a healthcare provider before starting, stopping, or combining medications. 5. Understand your risk factors. If you have diabetes, hypertension, or a family history of kidney disease, take extra precautions. When to seek medical attention. If you notice symptoms like persistent swelling, decreased urination, fatigue, or unexplained changes in blood pressure, consult your doctor immediately. Early intervention can prevent further kidney damage and improve outcomes. Medical disclaimer. This article is for informational purposes only and does not substitute for professional medical advice. Always consult a qualified healthcare provider for personalized recommendations regarding your medications, kidney health, or any other medical concerns. By understanding the potential risks associated with these common medications, you can take proactive steps to protect your kidneys and maintain your overall health for years to come. Stay informed, stay cautious, and prioritize your kidney health.